Hello, my name is Donna and I'm just going to do a quick video about something called acquired central hypoventilation syndrome. I was diagnosed with autism when I was around 2.5 years old. At that time it was known as infantile psychosis, and the assessment was done in a 3-day inpatient hospital assessment. And as an adult, I looked back to try to understand what things had come together to result in the issues that I had. So I grew up very face blind. When I was in late childhood, I was about 90% meaning deaf, so I was very echolalic. And by late childhood, by sort of like age 9 to 11, I came to understand receptive language and string sentences together, so that by the age of 13 I was able to do litanies at and in front of people, and then progressively get more conversational and eventually quite fluent with quite reasonable functional speech. I had significant visual, perceptual issues, so I couldn't see my world as a whole. I couldn't see a face as a whole, people as a whole, or a room, or objects. Everything was in bits, so I could only process bit. So I'd see the part and lose the whole, and tinted lenses have allowed me to filter out an amount of incoming information so I can glue together what I'm seeing, and I can see things as a whole. And those things, as well as being unable to integrate incoming information and dealing with information overload, those things contributed to a picture that presented as autism. In that mix, I also had immune deficiencies, so I was on antibiotics for my first 26 years for a lot of infections, recurrent infections that would last a lot longer than for most children, so up to about 3 months. And the infection would be about every 6 weeks or so. And so I also had food allergies and salicylate intolerance, and as an adult I was diagnosed with celiac. So there were a lot of things that affected my neurology on a whole range of different levels, and I was diagnosed as an adult with a collagen disorder which is called Ehlers-Danlos syndrome, and this is genetic. It runs on my mother's side of the family, and I know this because Ehlers-Danlos type 4 causes organ rupture, and I have a great-grandmother who died from uterine rupture, a cousin who had uterine rupture, another one who had aneurysms before in her 30s, and the son of one of my cousins had spleen rupture in his 20s. So that also fits with Ehlers-Danlos, which was diagnosed recently, but is something that I would have been born with. And collagen is an immune regulator, but it also is part of connectivity in the brain. So it helps you make connections in the brain. If you are not connecting up the way you're meant to, you're going to have incoming information resulting in delayed processing and overload, information overload, which may result in you processing this part, losing this part, getting that, losing this. And so I can certainly see where that overlaps with autism, which is in the literature, and I can see where that affected me in one way, but I can also see how immune stuff and allergy stuff also affected me neurologically, and for a long time I had mood, anxiety, compulsive disorders, which I think that certainly complicated for me. I'm also the child of an alcoholic, so I probably fit fetal alcohol spectrum disorder. My mother had been an alcoholic for several years before I was born, and was a very heavy drinker, drinking herself unconscious onto the floor in my first years, so I wouldn't be at all surprised if that had some relationship to my autism issues. And around 30% of kids with fetal alcohol spectrum disorder also have a pervasive developmental disorder or get diagnosed on the autism spectrum. So there's a range of different things that could easily have come together to account for my autism background. But one of those things is a hypoventilation syndrome. Hypoventilation means not breathing enough. Hypo and ventilation. And this sort of came out when I was going through, in 2009, I had an infection that lasted for 7 months. It was respiratory infection, Haemophilus, because I have IgG2 deficiency, so I couldn't fight this bug. And at that time, I noticed that I was waking up and when I in my sleep, and I wasn't breathing. Not because I was having any kind of obstruction, I wasn't in any kind of panic. I just felt like I was in suspended animation, and I found that I had no urge to breathe. I wasn't holding my breath. I wasn't striving for breathing. I just didn't have any drive to make myself breathe, or that drive was so small that it was almost like not breathing at all. And I laid there thinking, am I dead? And then I thought, wow, I'm dizzy and I have this headache and my lips were numb, my fingers were numb, and I thought, I think I'd better breathe. And I was waiting for the urge to breathe, which wasn't happening. I thought, I'd better make myself breathe. So I made myself breathe, and I said, oh, okay, I can breathe. There's something wrong with my brain going on here. And I told the doctor about it. And because I wasn't overweight and I didn't snore, the GP didn't do anything about it at that time. So that was 2010. Then in 2011, I was diagnosed with breast cancer. I had surgery. I went into chemo and another surgery after. But during chemo, I was having a lot of autonomic dysfunction, which is, autonomics is part of your autonomic nervous system. And so you've got your brain, spinal cord, peripheral nerves, and your peripheral nerves go to all your organs and all the peripheral parts of your body, and those are responsible for their sensory nerves, motor nerves, and autonomic nerves. So your autonomic nerves control your automatic functions, so it controls things like bladder and bowel, temperature regulation, circulation, blood pressure, heart rate, and especially also your swallowing reflex and breathing. So during chemo, my husband Chris noticed, yes, it's true, when you fall asleep, you're stopping breathing or you're very barely breathing. And so this was pretty scary for us because we didn't know during chemo rounds whether, in fact, when I went to sleep, would I be waking up the next day. So we got an SpO2 alarm, and we set this so that it would wake me up if my blood oxygen level was going too low. And so it started to wake me up, and I'd be woken a fair bit, but at least I was being relatively safe in terms of my blood oxygen level, but I wasn't solving this issue, and I was very sleep deprived, but we were busy with me saving my life from breast cancer. So what was going on in terms of a sleep disorder or a respiratory disorder was secondary. Out the other side of, during chemo, the oncologist said, it's not the chemo drugs that have caused this. The chemo drugs are making worse a condition that you would have already had. And I thought, well, maybe he's right, because I did have the breathing issue the year before in 2010. And then before that, when the GP had said to me, no, you don't snore, you're not overweight. And he said, how do you know that you're not breathing in your sleep? Because, you wouldn't know. I said, well, I woke up and it was in this. And he said, well, you wouldn't know. I said, I do know, because when I was a kid, I had this. And I said, during the day, I would have episodes where my breathing would become really depressed and be very, very shallow or keep stopping. And I'd start getting dizzy. And I had to consciously make myself start breathing. And I wasn't holding my breath. I just lost the respiratory drive. And so here I was facing the fact that I'd been told, okay, well, this probably goes way back. And looking back, yes, even before that, when I was in late childhood, I had got a functional speech by age 11. So by around 11, 12, 13, I was getting more fluent. And I remember saying, why do other people's brains keep them breathing and mine keeps forgetting? So that didn't make any sense to anyone in my environment, and so nothing was done. And yes, I was often pale, sometimes a bit, bluish, but that was normal for me. I'd had stuff like that going on since I was 2 or 3 years old, so nobody really thought anything different of it. And then looking back in that history, when I was about 10 years old, I swam the length of the Olympic pool underwater, which was 100 metres. And I came up, I was dizzy, but I wasn't desperate or gasping for air. I thought that I might be like Marine Boy, like that cartoon Marine Boy, that somehow I was different and I could amazingly get by without breathing underwater. And I did notice that the other kids couldn't do this, that they weren't like a dolphin, they weren't like Marine Boy. But I didn't have enough language to discuss it or answer for it or anything. It was just, here's a weird quirk and I've got a talent and I can swim vast lengths on the bottom of the pool. So it didn't occur to me that I could maybe have killed myself that way. It did distress the teachers, so they were desperately trying to get me up from under the water and get me out the pool. But being rather aughty, I was never easily managed, particularly at the pool, and I was always running off from the group and just doing my own thing. But yeah, so I never really thought of that as a disability. But then going back beyond that, when I was 3, I had jumped into the deep end at the city baths, and I had just gone straight to the bottom, according to my paternal aunt. And I didn't try to come up for air. I didn't seem to struggle or thrash about. I just sat on the bottom, probably looking around at the world underwater. And I do remember 2 old ladies who had jumped in and they dragged me up to the surface, and I remember their swimming hat things, and I think that they must have been fussing because they felt that they were rescuing me or saving me or something. And I guess I was drowning, but I wasn't drowning like most kids would drown. I was just drowning from a lack of breathing whilst sitting on the bottom of the pool. And then I had another episode like that, which was told to me by my older brother, that I was at a motel swimming pool in, I think he said, Derrenellum, and I jumped in the pool and I was basically on the bottom, again not striving for air, and he jumped in and he pulled me out of there. He was 5. And so both of these episodes had happened when I was around 3. And I'd been diagnosed with autism when I was 2.5. And so something had happened, say, around 2.5 to 3 years old, that resulted in this kid who didn't have enough respiratory drive to fight to breathe when she was in the water or underwater. And something had happened to the respiratory drive of this kid, who was going to then have these daytime apnea episodes where if she didn't consciously make herself breathe, she would probably pass out. So I guess it didn't really get to a crisis until 2009, when the infection had obviously pushed the damage to that part of the autonomic system that bit further, resulting in, I guess, a higher level of apnea. And it was during chemo that got pushed further. And so in 2012, I got diagnosed with moderate to severe mixed apnea, and that was done through a sleep study, and I was put onto CPAP. And they put me on CPAP because my MRI didn't show any brain tumours, I had no MS, I didn't have Parkinson's, I didn't have muscular dystrophy, I hadn't had a recent traumatic brain injury, so they couldn't find any, I didn't have heart failure, I didn't have chronic obstructive pulmonary disease, I had none of the textbook reasons for having central apnea. And on the CPAP machine, which is meant to help you get over an obstructive apnea, it was basically pushing air in, but because I wasn't then having the respiratory drive to breathe that air in, it was inflating me and then just hissing its way straight back out, like as if it was moving around in empty space, and I'd wake up and it would be just hissing its way back out of me. So it did help to a degree, but I began having clusters of central apneas that could be up to 5 minutes worth of not breathing in, 8 minutes of respiration, and the hypopneas, which is very low level breathing, were up to 90 seconds. And I said, this is scary, and I'm having this stuff during the day, and I don't know where this is going. And I had gone on to salt, and salt seemed to help with the autonomics. So if I took a half a teaspoon of salt around every 4 hours, I found that I could have less intense apneas during the day, and I could get the respiratory drive more or less working halfway reasonably for me. And what happened was I got put onto a bi-level machine, a VPAP machine, and once I was on that, the machine now would assist me both in the breathing in and in naturally breathing back out as well. So at that point, all of the clusters of central apneas disappeared, and I had a ramp up of a couple of minutes on that, which is how long it takes for the machine to start really kicking in. And I then found that I had a 109-second hypopnea in that ramp-up time, so I said, okay, goodbye ramp up. So now when I use the respiration, it just goes straight into full action. I was having the issues during the day, and the lack of breathing was making me get very sleepy, so daytime somnolence. So I sorted out a second machine with a battery facility so that I can use it in a carry bag, and then just it allows me to sit and watch a whole TV show without crashing out after about 3 minutes and going into apneas. If I feel like having a snuggle on the sofa, I can put on the respiratory stuff, and then I can stay awake and do that without my husband having to make sure that I don't fall asleep, because of course if I start falling asleep without ventilation, then I'm going to stop breathing, and sooner or later that's going to be a problem. So I have daytime respiration now, and daytime ventilation sometimes now, and every night I'm on ventilation. But then there was, I read about congenital central hypoventilation syndrome. And we wondered, well, okay, if around 40% of people with late onset congenital central hypoventilation syndrome, a genetic syndrome that causes hypoventilation. If around 40% of these people have developmental disabilities, and a lot of them are diagnosed with autism, would this be why? Did I have a second genetic condition in addition to the Ehlers-Danlos loss, and that this was the reason why I had this hypoventilation syndrome? So we got genetic testing for this, and it came back negative. And there is an acquired form of the same thing that presents just the same as late onset congenital hypoventilation syndrome. And the two are, you can tell the two apart, because if the person has all the symptoms of late onset central hypoventilation syndrome, but it comes back genetically that they don't have that, and essentially they have the acquired form. So when you look at the acquired form, you're talking about brain injury. And then there was the question, okay, so if I had a brain injury, when did this happen? So obviously it would have been there before the drowning incidents, which are symptomatic of late onset hypoventilation syndrome. So clearly what was going on was acquired before the drowning stuff. The drowning stuff happened because I already had a hypoventilation syndrome. So I was in an at-risk program for children at risk when I was 6 months old to 2.5 years old. And I was out of that program and in the care of my biological mother, who, as I said, was an alcoholic. She was also a person who was on Valium and significantly abusive on every level. And what happened was, I understand from one of my paternal aunts and one of my maternal aunts that I was being given Valium and gin in my bottles as a baby. And I can imagine that this was probably particularly once I was out of the at-risk program between 2.5 years old and the time that I went into a preschool at 3.5. So for a year, I suspect that I was being significantly endangered by a parent who was using this to keep me asleep. And Valium is absolutely not for babies. It's been found to cause sudden infant death syndrome. It causes a depressed respiratory drive, and you can cause hypoxic damage, so damage to the brain caused by a lack of oxygen, which is essentially the same as asphyxiation. And how many times that would have happened, I don't know, but it could theoretically have caused a level of damage to the autonomic nervous system, and then as is known to happen when you get further assaults on that system when you're older, such as a long-term respiratory infection or anesthetics, with surgery or chemotherapy, for example, then it pushes that damage further. But I couldn't have had that reaction unless that system was already damaged to a reasonable degree. When I was about 2 years old, I took to sleeping under the bed. And the reason for this was that my abuser in the middle of the night was putting a pillow over my face and I was being suffocated. And there were a number of times where I was also being choked and suffocated with this pillow. And I remember being 2 and really tensing my mouth to try to get a small amount of air whilst I was being suffocated. So there's a very strong memories of what happened. It's not a vague memory. It's not a recovered memory. It's a memory I've had all my life, and these events happened at least 5 times, if not more than 5 times. So in addition to being drugged with Valium and gin, which could easily have caused the damage on their own, there was further asphyxiation at the hands of my abuser. and coming to terms with that part of my autism, you know, because when you have oxygen deprivation, it doesn't just cause something like autonomic nervous system damage. You're also going to have things like agnosias, inability to process what you see with meaning, inability to process what you're hearing, difficulty, you know, with word retrieval. I could echo stuff, but even once I got functional speech, it was very hard for me to pull words up unless I put gesture to them. So there was something, you know, there was a whole lot of stuff that was neurologically not the norm. And yes, there was information overload issues and processing the part and, you know, losing the rest, which is common in people with autism, and that was still there and is probably accountable from a whole lot of other stuff that I came into the world with. But there was other stuff that I think looks like an acquired brain injury, and obviously I've done really, really well for a person who's come from that level of challenge, with a lot of effort and a heck of a lot of help and support, and including from the professionals who have helped me along the way. And I guess I wanted to make this video as part of putting it out there that if you have somebody who is being diagnosed with idiopathic central apnea and they can't find the cause, do they have acquired central hypoventilation syndrome? And if so, what was the cause of them acquiring that? Was it, you know, was it something like a severe infection in early childhood? Was it, you know, a near drowning incident that they didn't know about? Or was it something like has happened to me? And I guess I like to take something that's very hard to deal with and at least put it to some use. So I hope that that information is of some use. I guess it's also important for me to be able to handle looking at that and saying, well, that was damage. That was you know, somebody willfully damaged me, and that person was the person who was meant to be responsible for me. Yeah, sure. And you can give me all the excuses in the world, you know, psychopathy, alcoholism, personality disorders, living with a partner they didn't want to live with, having children they didn't want to have, dealing with, you know, a womanizer partner or domestic violence. It doesn't matter. It doesn't matter what your reason is. Being addicted or an alcoholic or whatever you want to say, postnatal depression or a million excuses. For the rest of my life, I probably will never ever get an apology from the person who's done all of that. I am not even considered enough of a human being, because that person's orientation is that they owned me. I was an object. They had a right to do whatever they wanted to do. And in their words, you know, you were the doll, and if the doll was bad, I was allowed to smash it. Well, yes, my abuser did smash it. I'm here in spite of that. And I do not carry the shame of that, and nor will it break me if I never get acknowledgement or an apology from the person who committed all that on me, because I don't expect that from a psychopath. I don't expect that from an abuser. So all I can do is take what the situation is, and hopefully it's going to be, the information's useful to somebody else. That's it. Thanks a lot.